Hey everyone, this is Evan Wilson. Again, at the time of making this video, a fourth year resident in the McMaster Radiology program. Our next installment in the McMaster Clinical Skills Radiology series is going to be part of the neuro curriculum. And we thought the best way to do that would be to start with really teaching how to approach interpretation of a CT head. We have a series of 2 short videos, this being the first one, about approach to CT head. Before you really get into interpreting a CT head, you just need to know the basic anatomy to orient yourself where you are as you scroll through a CT. So that's what today's video is going to be centered on. So what are we going to talk about in today's video? We'll again go over imaging planes briefly, and then we'll get to the internal structures of the brain. So those are the lobes of the brain, and then some of the deeper structures, including the basal ganglia, the midbrain, the pons, and the medulla. We'll then go into the CSF spaces, the ventricles, and the cisterns, and then we'll briefly just make note of the orbits and sinuses, although we won't go into them in detail today. I really want to stress that this is not in any way a comprehensive anatomy outline. This is just to get you oriented as you scroll through a CT scan to the major structures, so you can know where you are, where you're oriented in space, and know the major structures so you can start to approach a CT head in terms of looking for pathology, because that's where we really want to get to with these intro videos. As we go through the presentation, I'll have an axial image of the axial images of a CT head coming up on the right side of the screen, and I'll be able to show where the structures are as they are labeled on the left side of the screen. So first, we'll again go over the planes of imaging, which I've talked about in some of my other videos. If you haven't seen those, this can be an intro. I should say that if you feel like you have a good understanding of planes of imaging and as well as a good understanding of neuroanatomy, you can probably skip this video and just move on to the part 2 video about interpreting a CT head, because again, this video is solely going to be focused on those concepts. So first, when we look at planes, we have the horizontal plane, or much more commonly in radiology called the axial plane. And that's if you just take this brain here, you slice it in that transverse or horizontal plane, as this rectangle is showing, and then you're viewing it kind of en face, as if you're below and the patient's laying down with their feet facing towards you, looking up at the ceiling. So this is what that looks like as we scroll through this axial slice. Again, we imagine the patient's feet facing us, laying down and looking up at the ceiling. And we're looking at them from below. So this is the patient's eyes. So this is anterior. This is posterior. This is the patient's right, and this is the patient's left. Again, just remember they're laying down with their feet facing us and we're looking at them from below. That's the orientation. And then as we scroll through the axial images, we can see all the internal structures on our CT. And we'll go from top, moving downwards toward the bottom. And as I scroll through and move throughout today's video, I'll try to tell you which direction I'm going to keep you oriented. The next imaging plane that we have is the sagittal plane. So that's if you have the brain as shown here, and then there's a slice of cutting the brain right down the middle, and then we're looking at that rectangle en face. So in this example, it's right in the midline, so we're seeing the midline structures of the brain in the sagittal plane. Patient's looking this way, so this is anterior, and this is posterior, and as we scroll through, we'll be moving right to left or left to right. And that's seen here. This is actually an MR. It was just an MRI. It was just more accessible as a scrollable stack when I made this video than a CT was, but it delineates the anatomy probably even better than a CT. So again, we're in the midline here. We can see all the midline structures in that sagittal plane. Here's anterior, here's posterior, and as we scroll through, we're moving from right to left and left to right. The next imaging plane that we have is the coronal plane. And this is just like the patient's facing us. We're cutting down really orthogonal to what the sagittal plane was. And then we're scrolling anterior to posterior or posterior to anterior as we slide this rectangle forward, and we're looking at it en face again. So you can imagine this patient's looking at us. This is the patient's right, and this is the patient's left, and then we would scroll through. Again, this is how it looks on an MRI. So here's the right orbit, here's the left orbit, and we would move posteriorly as we scroll through the brain. Really in radiology, when we are using these planes, for every case we look at, we're looking at all three planes in conjunction with each other to try and put together the findings and come to our diagnosis. But for the rest of today's talk, just to keep things reasonable in terms of the length of the video, we're just going to focus on the axial plane from here on out. So moving into the actual brain structures, the first thing that we can talk about is the brain tissue itself, and specifically the lobes of the brain. But before we do that, we can talk about the actual material that makes up the brain, and that's gray matter and white matter. So you'll notice when you look at a CT, you can see two different attenuations of the brain tissue. You have this ribbon going on the outside of the brain, which is brighter on CT. It's kind of more white, which means it's more radiodense. And then centrally within the brain, you have this darker region, or more hypoattenuating, which means it's less radiodense. And what those are gray matter and white matter. They have two different radio densities to each other. The gray matter has more cell bodies, and it makes up really the core, they come together to form the cortex of the brain on the outside. And then the tracts from those cell bodies, the axons, which project down to the rest of the brain and also down to the body, forms this hypoattenuating white matter, which kind of branches out to the cortex, as you see here. As we scroll through this brain, you can see this is a young, healthy patient with quite a full brain and really healthy looking cortex. You can see a pretty thick layer of nice white, uniform, and bright, dense cortex, making up the gray matter of this patient's brain. And then there's a pretty well-defined junction here between the gray matter and the white matter. And then centrally, you can see all this white matter branching out to the cortex. So this is what a normal gray-white differentiation looks like. It's important to know the difference between gray matter and white matter because it becomes very important in stroke imaging. Because one of the key findings of stroke is we start to lose that gray-white matter differentiation. So moving on to the actual lobes of the brain, we can start kind of at the top and work our way down. So let's scroll to the top here. So the first lobe that we'll see anteriorly at the top of the brain is the frontal lobe. That's here. And then more posteriorly, we'll see the parietal lobe here. How do we know where the dividing line is between the frontal lobe and the parietal lobe? Well, that's this prominent sulcus called the central sulcus, which we see here. And anterior to that, we'll have frontal lobe. Posterior to that, we'll have parietal lobe. Sometimes on an axial slice, it can be difficult to tell exactly where the central sulcus is, depending on positioning, but it should have this prominent oblique orientation, which almost forms the shape of an omega, of the Greek letter omega, which you can Google to find a picture of, and it's called the omega sign. Sometimes it's not that easy. For example, on this axial slice, as we scroll through, it's hard to really tell where that omega sign is. I suspect that it's probably maybe right here where we're catching central sulcus, or right here, which may be more likely. And everything anterior to that point is going to be frontal lobe. Everything posterior will be parietal lobe. It usually is easier to tell if you pull up the multiple reformats on the study and scroll through to try and orient yourself in multiple planes. As we move more inferiorly in the brain, again, starting from the top here, we have our frontal lobe, our parietal lobe, and then as we scroll inferiorly, we'll start to encounter your temporal lobe, and then more posteriorly, your occipital lobe. As we scroll through and try and orient ourselves, we can see that as we move from the frontal lobe downwards into the region of the temporal lobe, there's another prominent sulcus here, or fissure, and that's called the Sylvian fissure, which comes up in the middle cranial fossa and kind of curves around posteriorly. And that divides the frontal lobe, which we see here, with the temporal lobe, which we see here. As we follow that temporal lobe downwards into the middle cranial fossa, where it's kind of hugged by the skull here, that all remains temporal lobe. Posteriorly, the posterior-most aspect of the brain, we have occipital lobe. And occipital lobe, the fissures that divide it between the temporal lobe, parietal lobe, and occipital lobe are also not well seen on axial imaging, but it occupies this posterior-most space of the brain as we scroll through. Another important intraaxial or brain tissue structure that we have is your cerebellum, and that occupies most of the posterior fossa at the posterior inferior aspect of the cranial vault. And you can see your two cerebellar hemispheres here. As we scroll through, you move from the structures we were just talking about, the occipital lobes, downwards into the cerebellar hemispheres here. In this posterior fossa, in this same slice, you can see a few other structures, which we'll talk about shortly, the pons and the fourth ventricle. We'll then talk about the deep structures of the brain, and we'll again start from the top of the brain and move more inferiorly to the bottom of the brain. Scrolling up to the top, the first deep gray matter structures that we encounter are the basal ganglia and the thalami. So what do those look like? We can see, well, they're deep in the brain. They're more dense than gray matter, or than white matter, sorry. They're more dense than white matter. And again, how do I know that? It's brighter than the white matter. It's more the attenuation of the gray matter, which is this brighter outer ribbon. So we know there are gray matter structures which are deep in the brain. And the first one that we see here is the caudate, which kind of hugs the border of the lateral ventricle, the CSF attenuating structure here. If we scroll through, we can see it's got a rounder head, and that's the caudate head. And it doesn't end there. It actually branches backwards along the margin of the ventricle, and that's the caudate body. Directly adjacent to the caudate and separated by this thin strip of white matter, which is the internal capsule, we have another deep gray nucleus, which is your lentiform, which is actually made up of two separate nuclei, the putamen and globus pallidus, but I'll leave that for today. And that's the lentiform nucleus is this more triangular deep nucleus that you see here. Deeper to that and closer to the midline, we see these two paired gray matter structures here, and those are your bilateral thalami. Moving more inferiorly in the brain, again from the structures we just talked about, so your basal ganglia, your thalami, and moving inferiorly, we then come to this structure here, which is your midbrain. Your midbrain kind of looks like you're looking at Mickey Mouse with two ears, although I probably shouldn't say that because there is a sign in radiology called the Mickey Mouse sign, which is supposed to be when your midbrain looks more like Mickey Mouse, but I find it just a terrible sign because to me it just always looks like Mickey Mouse. So I never know how to decide if it looks like Mickey Mouse or not. The midbrain is located deep within the brain, and it has these two prominent structures called the cerebral peduncles. And those are prominences made up by dense conglomerations of your white matter tracts, specifically your corticospinal tracts, traveling down from the brain through these peduncles to get to your spinal cord. Centrally, it also houses your cerebral aqueduct, seen here on the left and here on the right, which is an important conduit for CSF traversing the ventricular system. As we move more inferiorly, again, we have your midbrain here, and slide down inferiorly, we come to the pons, which is this rounded structure in the posterior fossa anterior to the cerebellum. You'll notice that on CT, the pons really looks heterogeneous. There's a streaky hypoattenuating density through it. And that's because on CT, you have a lot of dense temporal bone in this region in the posterior fossa, and that just creates a lot of artifact. So this is not a real finding within the pons. It's all artifact created by this bone, which is why we can often see pons and the other posterior fossa structures much better on MRI than we can on CT. Not uncommon to have really bad artifact in this region on CT. And then pons is an important brainstem structure which contains really all your motor fibers going from the brain to the rest of the body, as well as important conduit for transmission of information from the rest of the brain to the cerebellum. And as we move more inferiorly, again, from the pons downward to this kind of prominent, almost looks like the spinal cord, but more prominent structure, that's your medulla. And your medulla is responsible for important structures in the body, which are really necessary for life, such as breathing regulation. So you really don't want to have a hemorrhage or a tumor causing mass effect on the medulla, but it does happen. So really important area to look. Again, this is inferior to the pons and really just housed by the inferior aspect of the cerebellar hemispheres on either side. As you scroll more inferiorly, you'll see it thins out and becomes this rounder structure, and that's the superior aspect of your cervical spinal cord. You can see it's a little bit less kind of dilated out and prominent than the medulla. Again, moving back up in the brain to our centrally located CSF containing structures or cerebrospinal fluid containing structures, we have your ventricular system. So if we start at the top of the ventricular system, we first have your lateral ventricles, which are these kind of semi-lunar, really oddly shaped structures located in the center of the supratentorial brain. If you have a healthy young patient with a pretty full, normal, healthy brain, usually the lateral ventricles are quite small, as in this case, and you can't always follow their anatomy to visualize the entire lateral ventricle. For example, if I follow the lateral ventricle along here, you're kind of losing it, and in reality, it tracks forward to communicate with this structure here, and on the other side here, which is the temporal horn of your lateral ventricles. It just becomes collapsed and low in caliber beyond the resolution of CT in healthy patients much of the time. If you have an older patient who has some brain atrophy and they've started to lose some volume in their brain, you'll see these become much more prominent and dilated. And it's important not to confuse that with acute hydrocephalus or dilated ventricles from increased CSF pressure within them versus just a normal compensation to surrounding cerebral volume loss. And again, your lateral ventricles have a few different pieces of anatomy. There's your frontal horns, which are the most anterior horns in the frontal lobe. There's the body, which kind of traverses back from the frontal lobe towards the atrium, which is kind of a confluence of the different horns of the lateral ventricle. And then we can't see it here, but there's an occipital horn extending posteriorly, and as we've said already, a temporal horn extending toward the temporal lobe. As we move down from the lateral ventricles more inferiorly in the ventricular system, we'll then encounter the third ventricle, which the lateral ventricles drain into. And that is this thin, small CSF attenuating structure just interposed between the two thalami. So that's your landmark. Again, quite small, especially in healthy patients when it's non-dilated. It's just this little structure here. As we continue to follow it inferiorly, we then come into this structure here, which we already alluded to when we were talking about the midbrain. It's the cerebral aqueduct traversing the midbrain, draining CSF from the third ventricle. And if you follow it down, you can see it connects to the fourth ventricle, which is slightly dilated out structure as you reach the cerebellum, which is housed by the cerebellar hemispheres, and anteriorly the pons. So that's your fourth ventricle. So running over the ventricular system one last time, lateral ventricles drain into the third ventricle, drain into the cerebral aqueduct, drains into the fourth ventricle. Within the ventricular system, you'll have the choroid plexus, which produces the CSF, which you can see some of here, this hyperdense material within the lateral ventricles. That will produce CSF. It will drain down the pathway, which we just went over, and then it will drain from the fourth ventricle through a few foramina called the foramina of Luschka and foramina of Mengendi into the extraaxial CSF space, coating the spinal cord as well as within all the cerebral sulci and cisterns. So what are the cerebral cisterns? They are really what we just said, these prominent extraaxial CSF containing spaces lining the brain, but that are not within the ventricular system. There are quite a few actually, different basal cisterns in the brain. I don't really want to belabor the point and get into all the detailed anatomy today, but if you're interested, there's the suprasellar cistern here, which is above the sella turcica, which houses your pituitary, which you can't really see very well on axial imaging. Here's your interpeduncular cistern between the cerebral peduncles. There's your ambient cisterns on either side of the midbrain, your quadrigeminal cistern posteriorly, and others. As I said, there's quite a few cisterns. It's really just important to know that there are these basal CSF spaces which contain cerebrospinal fluid around the brain. And really why we care about them is they're important to look at in cases of where we're suspecting mass effect or increased pressure in the cranial vault, because they can become obliterated or effaced by either the swelling or an adjacent mass that would cause. And the last structures that we need to not forget to look at, which we're not going to go into detail for the purpose of this talk, again, just because I wanted to get you grossly oriented to the anatomy so we can focus on the interpretation in our next video, are the orbits. So you may have to make sure you scroll through the orbits and the globes to make sure there's no mass, asymmetry, hematoma, that sort of thing. And our sinuses, which are these air-containing paranasal structures. Again, not really well windowed for the sinuses on this study, but I don't have the ability to change the window as I'm making this video, but we can change the window settings to see the air and the internal structures or rule out any pathology within these sinuses if we were actually at a workstation. You have your paranasal sinuses surrounding in the facial bones surrounding the nasal area, and then you have your mastoid air cells, which are deep within the temporal bones, adjacent to your inner ear structures. So hopefully you enjoyed the video today. That's just a brief overview of the most basic anatomy that you can see in the brain on a CT head. And I hope you're now able to orient yourselves as you scroll through a CT head so you're ready to move on to the next video and start interpreting some of the pathology.